Welcome to Afaxys Candid Conversations in Public Health, a new podcast series from Afaxys, a public benefit corporation serving public health clinicians and their patients. Join us as we head to the front lines of sexual and reproductive health care, bringing you timely discussions with leading experts who are shaping the future of public health.
Good afternoon and welcome to Candid Conversations in Public Health, an Afaxys-sponsored program developed to bring together leading experts in the field of sexual and reproductive health to discuss relevant topics of importance to the public health community. Our session today will be focused on STD clinical care and considerations, views from the trenches of 2025. I'm Beth Attias, and I will be moderating today's first conversation in the series. And I'm joined by Dr. Kristen Feldman, Vice President of Medical Affairs at Afaxys, and our expert guest, Dr. Tammy Bennett, Associate Director of Clinical Training, also known as the CTC-SRH, which is the Clinical Training Center for Sexual and Reproductive Health, and Dr. Kristin Metcalf-Wilson, Project Director, CTC-SRH. So Dr. Metcalf-Wilson and Dr. Bennett, thank you so much for joining us today. Could we begin with each of you sharing a bit about your background and your role within the public health STD arena and specifically at the center? And Kristen, would you like to go first, please?
Thank you, Beth. Thank you so much for having us. We're excited to talk a little bit about what we do and who we deliver our products to. I think it's really important to see how the Clinical Training Center specifically addresses public health issues in today's environment. So I am a women's health nurse practitioner by training and doctorally prepared, and been doing this work for over 30 years, practicing in Title X settings, Planned Parenthoods, health departments alike. A lot of safety net community clinics is where I've spent most of my career practicing. And then I came to this role when the training center began as a consultant, and now as the director, leading the training center and how we deliver trainings and professional development to the Title X community and to the clinicians at large.
Great. Thank you very much. And Dr. Bennett, could you also share with us your background and role at the center?
Sure. So thank you again for having us. I am Tammy Bennett. I'm doctorally prepared, and I'm also a women's health nurse practitioner. I've been practicing for 25 years. Most of that, except for 2 years, I did private practice, but most of the rest has been in public health, whether it be in the state government, statewide consultant, or boots on the ground in the region doing the work. I'm thankful that I got this new position with the CTC-SRH. I feel like it has been a wonderful experience to be able to support, other Title X providers nationwide and help figure out where are the gaps in the education so that we can work to meet those gaps and support our Title X providers in the field working day to day.
Great. Thank you. Such tremendous experience and mission for your work, and certainly very relevant in today's world. So thank you so much for joining us and bringing your expertise and those introductions. And Dr. Kristen Feldman, would you also like to introduce yourself and perhaps share a bit about Afaxys for our listeners who might not be familiar with the work that you do, and also your role within the organization?
Sure. Thank you for having me, Beth. I am Kristen Feldman. I'm the Vice President of Medical Affairs at Afaxys. I'm also a practicing gynecologist. I've practiced for a couple of decades in both private practice and community and public health. Just to tell you a little bit about Afaxys, we are a public benefit corporation serving public health providers and their patients with sexual and reproductive health care products and services. We're a little bit unique in that we have a pharmaceutical arm with a portfolio of both emergency and oral contraceptives. And we also have a group purchasing organization that allows public health providers to access discount pricing for just about any item they might need to run their clinics, ultrasounds to gowns, to all kinds of medications, to staffing services, you name it. And we're really proud to be a leader serving the needs of the public health community, and excited to be on this podcast today. Thank you.
Great. Thank you all for those introductions. So I'd like to start with perhaps sharing with our audience maybe a bit more background specific to the CTC-SRH and the work that you and the community that you serve engage in together. So we had the brief overviews and introductions. So maybe a little bit more specifics about that work. And Tammy, perhaps we could start off with you to help our audience learn a little bit more about the CTC-SRH.
So yes, the Clinical Training Center is funded by the Office of Population Affairs to support and educate and train and assist Title X clinical providers throughout the network. And we do that in the form of offering different clinical skills training, which could include, intrauterine contraception, removal and placement, pain management with those procedures, mentoring, and also challenging cases for IUCs. And then we also do resource development. We have toolkits, we have job aids. We just try to identify where are the gaps, what needs to be met, and let's see how we can help those providers the best. We also, and Kristen may want to talk about this a little more, but we put on an annual National Reproductive Health Conference, which is a phenomenal event. It is for Title X clinical providers, but any provider can attend because quality sexual and reproductive health is quality sexual and reproductive health, whether you're in a Title X setting or whether you're not. And then we also collaborate with other agencies, including the Reproductive Health National Training Center and the American College of Obstetricians and Gynecologists, ASTO, National Council for STD Directors, just a lot of other national players so that we can keep in sync with what they're doing and what we need to do.
Thank you. Certainly, you all are very busy and integrated in so much with the community and with the major medical organizations. So thank you for that overview. Dr. Metcalf-Wilson, do you have additional comments to add specific to the organization, maybe from your perspective?
Certainly. And please feel free to call me Kristen.
Okay. With Kristen and Tammy.
Yes. Yeah. Well, I think that our history lies within our professional development and clinical training. And so really become a trusted provider in clinical education using evidence-based guidelines that are out in the world, relying heavily on CDC guidelines and updates, the medical eligibility for contraception. We rely on those things as they're developed. The evidence and data-driven medicine is important. And so we identify gaps in the communities around the nation. For example, a perfect example is our work in syphilis over the past year. We did receive some funding from the Syphilis National Task Force, asking us to do a pilot study around hotspots that have been identified from the CDC that have a large increase, sometimes double-digit percentages over the last several years in syphilis and congenital syphilis. And so having given the directive about how to improve or decrease those rates, we did a pilot study that implemented point-of-care testing within those communities at a minimum with every pregnancy test that was done. So if somebody came in and obviously in a geo hotspot, you'd like to screen everybody, but we provided the test and we educated on the test. We educated on identifying, screening, treatment, management of syphilis. Tammy had a key role in that because of her experience doing that for the state of Louisiana. That's something that we're really proud of because we do see that it's making a difference. If you can identify one positive syphilis person in a small community like that, you can have a significant impact. And so now we're rolling that out to the nation and the Title X, telling people about our experience, what's needed in the knowledge gaps. And because, I don't know, Tammy, Kristen, if you guys share too, when I was trained back in the 90s, early 90s, we learned about syphilis. There was a traditional way of approaching it. And there are lots of the current generation that are practicing haven't seen it. They didn't know how to identify it. They didn't know what the rash looked like. They didn't know how to read the algorithm or the test. And so there was a lot to be trained on. And so that's been our experience, is that training like that, identifying gaps and really reaching out to folks that are at those safety net clinics, to folks that typically don't have access to healthcare, can be a significant role that we play.
And just to tag on to that, Kristen, one of the things whenever we're working with providers and training on syphilis, that's nothing to be ashamed of. I mean, we thought that we were done with syphilis. That was a thing of the past. We conquered it. And then lo and behold, it raised its ugly head again. And so the fact that we were not trained in our prep, in our, graduate studies or whatever, that's not a slight on anybody. It just means that we got to get up and educate it now. Because what we've also found is providers who weren't educated aren't comfortable with screening, because if you get a positive, you're responsible for that result. And then now what? We do have a Syphilis 101 education that's available for any provider that wants to learn more. So just a shout out to that. They can go to our website and look at that recording.
Yeah. We do easy tools, things that you can keep on your desk in clinic that you can just pick up and look at the algorithm and say, I got this, what's the next step? So that people get comfortable with it, and they're using really trusted tools that we develop with subject matter experts and the other partners that we have identified.
That's fantastic. And Kristen Feldman, maybe you can share a perspective from Afaxys and also your clinical practice as well with point of care testing, and maybe how Afaxys is also getting involved in this point of care testing.
Right. I mean, we are definitely seeing a trend towards point of care STI testing among our customers. On our group purchasing organization site, we have availability of rapid tests for syphilis, HIV, gonorrhea, and chlamydia. And I think that's just a really important access point for patients to be able to receive the care that they need. And just a quick plug for the CTC-SRH website. As you mentioned, it's great for any provider, whether or not they're in the Title X network. I love a good algorithm. And, things have changed since we trained, to your point. We now have different screening modalities available, different algorithms that we can use from back when I trained. And you have some excellent job aids and quick reference guides on your site that I find very useful in my clinical practice as well.
Oh, thank you. That means a lot. Yeah.
That's great. Should we share what that site is for the listeners? Do you want to go ahead and say that? Sure. And so if they're listening in, they'll know what that website is.
It's CTC-SRH.org.
Perfect. Great. Thank you. So in addition to syphilis, are there other trends in STDs that you're seeing? And maybe even, of those trends or other STDs, like certain geographies or patient populations that you see being more impacted than others?
I think it is imperative that we identify those social determinants of health, making sure that everyone gets access. But, we really do see the trends in STD care moving towards people outside of Title X, for sure. I mean, Tammy and I just returned from a primary care conference, and they have a whole track of trainings on sexual and reproductive health care, women's health care, STDs, breast health, because we're really seeing that, for those folks in Title X, it's really an uncertain time. And if those folks aren't there, where are those patients going to go? And so it really is important that we make sure that others outside of the Sexual and Reproductive Health Network are beginning to include STD screening, cervical cancer, breast cancer screenings. Like, they need to know that they need to look at the whole body and make sure they're addressing sexual and reproductive health. That's kind of the trend that we're seeing, is that more folks are interested in being able to provide that, knowing that some of their community access points might go away.
I couldn't agree more, Kristen. And one thing I just want to mention, I was reading an article this morning from the Department of Health in Virginia. They said that syphilis is 100% preventable. Every single congenital syphilis case is a failure of the healthcare delivery system and the public health system. And that was a quote from that article that just resonated with me. Nobody wants to fail. We all want to succeed. We all want our patients to be well and have a good outcome in their pregnancy. But the fact that we have such a high rate of congenital syphilis throughout the United States means something's not working. And so I could not echo more that this is an all hands on deck approach, that we need primary care providers, urgent care providers, ER providers, adolescent medicine to all be screening for syphilis and be comfortable screening and with the treatment. So all hands on deck, hashtag.
I agree, Tammy. And I think the work that we've done in syphilis has moved into other areas too, like HIV prevention, so PrEP and PEP services. We also were, tapped to do some work in women of color in the South, because providers and women of color in the South don't see themselves at risk for HIV. And so it's really, we need to close the gap there. And so whenever we find gaps, we try to jump in at a community level and work with providers to make sure that they're increasing access to specific things like PrEP and PEP services.
Great, thank you. You mentioned your upcoming conference, which I know that the listeners will want to for sure know more about that, and that you were developing some toolkits and educational components that would be released, at that conference. Could you share with us a bit more about those toolkits and any information about how people might register for the conference and venue?
Well, just funny you should ask, Beth. Yes, we have developed a PEP toolkit that we are going to launch along with our PrEP and PEP 101 session that we will have as an opening keynote. And so we are really excited about this. We have seen PrEP and PEP services increase over the years, but not enough. And making sure that folks can get the screening that is needed, the testing that is needed, and be prescribed the medications. And the medications are much more accessible than when I was originally doing PrEP. I mean, this daily medication that was kind of arduous to take and expensive, and you couldn't necessarily get it covered on your insurance. But now it's really available with that discounted pharmacy cost. And you can do injectables that, is new this year. So yes, there's a lot of new information to come out. We're excited to present that. We have other toolkits that are important for providers too, that include some protocols like for IUC services, expedited partner treatments. All of those things can be found, and they're just quick job aids to help you implement a service that maybe is new at your clinic level, just to give you the tools so that you can get started and hopefully make it easier to implement new services in the future. So making it as easy as we can to make sure we get things started.
Yeah, it certainly sounds that way. I mean, all the providers are so busy, but it sounds like you are doing so much of the background and the legwork and the assembling that it really is quite a service to, other providers in the sexual and reproductive health arena.
Yeah, we're trying to be leaders in the community. So also in the current landscape, there's a lot of uncertainty. There's a lot of providers that are uncertain about what they can and they can't do at the state level, what they can and they can't talk about at the state level. So we're really trying to dispel misinformation. So education and science is key, and we need to make sure that we keep pushing it out.
Beth, I can't hear you very well, but I think what you were asking about is the conference and whether or not I had any comments about the conference. And again, shameless plug for this conference. I've attended several years in a row. Last year at the live conference in Philadelphia, there were some really great talks. Again, I am not a Title X provider, but I found the content to be exceptionally helpful, interesting, and educational for all providers of sexual and reproductive health. There were some great talks about the new QFP guidelines last year. Reagan McDonald Mosley gave a great talk about health equity and access to contraception. So just some really interesting things. This year's conference is virtual. I understand y'all alternate back and forth between live and virtual. And, again, for any listeners who are looking for some low cost, really effective CME, I cannot recommend this conference more highly because it is, just a fantastic resource for those of us providing care to patients. I do have a follow-up question for Kristen and Tammy on that topic, which is, as you know, Afaxys' mission is to support the public health community, and you're supporting the public health community by giving such a great conference. And I'm wondering if there are any other new opportunities from your perspective for us to partner more closely with and to support the public health community, specifically in the area of STI?
I would love to always partner. One of my passions is STIs, and it always has been. I don't exactly know why, but I think a lot of times providers, and I can say this because I was one, or I am one, we have our own implicit bias, right? And we look at somebody and we think, oh, they don't have an STI. They're married. They're mutually monogamous. How do you know unless you ask? So I think we've got to get over that fact and understand that everyone really does need to be tested. Because when you look at the data, a lot of the data comes back that we have a problem in certain communities or certain races. But then you look at who's being tested, and it's those races or those communities that are being tested. But what about the others? So do we really know the prevalence of STIs that are out there if we're not testing everybody? And so I'd love to partner with you on any way we can get that message out there.
That's a great point. And I think at-home STI testing is probably the wave of the future. So out of curiosity, are there any situations in which you're incorporating at-home STI testing into your clinical workflow or any projects that you have going on in that arena?
We are strongly encouraging point of care testing. And, if you look at the market is changing as well. So they're now more readily available. You don't even need a provider necessarily to be the one shipping it to your house. We like to think of ourselves as like the gatekeeper of the STI testing, but it really is up to the individual now to access that because they've become so much more accessible and effective. I mean, there's 3 FDA approved on the market now. And for syphilis and HIV, one of them is a combination test. One of them is just syphilis. One of them is HIV only. So there's really so many more opportunities that I think as a at-home testing kit that people can either pick up at their office or have it sent to their home that includes all of the tests and where to collect them based on how you have sex. And I think that that's important too when people come to get screened, that we understand where do we need to screen? What kind of sex are you having? Right. And that's a key element, I think, that people need to be more aware of too.
Great point.
And one other thing I would add is, for me, my comfort zone is you come to the clinic and then I get the vital signs and I do this and that. But that is also the brick and mortar, model of healthcare, I feel like is I don't think it's going to go away. But I think we need to open our eyes and embrace telemedicine or the self-care options that patients have where they know they need to be tested, they can get the test, and then, it goes to your doctor's office or they can call you with a telehealth appointment for treatment. So it's really broadening our providers' eyes that there's more than one way to skin a cat, so to speak.
Yeah. Agree. And I think COVID taught us that, right? I mean, if you had your eyes open during COVID, people weren't coming in. We had to get to them in another way. And I think that started this trend of point of care testing where we realized, wow, we really need to be a little more open to new things. And I think that this is a perfect example of that.
So we're nearing the end of our time, but are there additional comments, questions, for one another before we wrap up our session?
I have one thing. I would really encourage anybody listening that wants to know more about what we're doing and what tools and toolkits we're coming out with to go to our website, and in the top right corner, they can sign up for our newsletter. That's where you're going to be able to get the emails that say, hey, here's a webinar you might be interested in, or this is newly released, or here's the recording if you missed it. So we encourage you to sign up for that so you get firsthand information.
Thanks, Tammy. I agree. And I think, people kind of think, oh, they have this conference and it's this one time a year thing. But all year long, we're having live webinars, podcasts, drop-in learning activities, creating new toolkits. So anytime something's launched, it'll be in our newsletter. So you'd be able to get it hot off the press, so to speak.
That's fantastic. I mean, you provide so much robust and incredibly informative information in so many different formats. So I know that the listeners will eagerly sign up for those newsletters. So thank you so much for your time. We know you're so busy. It's been a tremendous, robust discussion. And so we appreciate your time and all the incredible work that you're doing on the sexual and reproductive health front. So thank you.
Thank you for having us.
Thank you.
Thank you, Beth, for hosting.
Thanks for listening to Afaxys Candid Conversations in Public Health. To learn more about our mission and resources for clinicians, visit afaxys.com. Don't forget to follow or subscribe so you never miss an episode, and we'll see you next time.